Hello, everybody. Welcome back to the Incubator Podcast. We are live at the CHNC Symposium this morning. Daphna, how are you?
I'm doing great, buddy. Thanks.
Yeah, very good. We're joined by two physicians, Dr. Katie Huff and Dr. Pritha Nayak. Thank you so much for being on the podcast with us this morning.
Nice to be here.
Yes, thank you for having us.
So we were joking off air that you are part of the focus group on intestinal failure, and it really has to be intestinal failure. So can you tell us a little bit about what does that entail, intestinal failure? What kind of babies are the ones that you are interested in focusing on in terms of quality improvement and research?
So the babies we work on are those who are born with not normal intestines, those who cannot feed, who are on prolonged parental nutrition, or those who are born with normal intestines and they undergo surgery and for some reason they can't eat.
Yeah, so like, for example, a jejunal atresia or a baby that has some form of maybe necrotizing enterocolitis and ends up with a short gut. So those are the babies that you guys are focusing on.
Yes.
We've had some real challenges with the babies who post their, gastroschisis. We've really, I think that's been impressive for us in the last few years in our unit. So.
Yeah, we've had babies with gastroschisis in our unit that had pretty significant ileus.
Yeah.
And it was feeding these babies and getting them to grow it's just so challenging.
Yeah.
It's so challenging. Why the intestinal failure as an interest for you both?
Yeah, I think, so we're also part of the gastroschisis group. You brought up gastroschisis and neck. And
a lot of overlap there.
I know, there's a lot of overlap with those other two groups.
Yeah.
We just both really have a passion for nutrition and intestinal failure. And so we wanted to have a more broad group. So that's why we started this group last year. We're less than a year old, just to try and help focus on those kind of other groups that might be falling through the cracks in the other focus groups and kind of see if we could help expand knowledge and improve outcomes in those babies as a whole.
So for the people who are not, who do not have the privilege of being here with us this week, what are some of the main takeaways, some of the ideas that you guys are bringing up from your group at the CHNC Symposium about intestinal failure and how to get babies to grow in that situation?
Yeah.
You can go one after another.
You go ahead.
I think what we want to say is that there's no evidence on what works and what doesn't. It's a very lucid
That's what it
area.
feels like.
I guess that's entire neonatology for you. And we want to bring it up. We want to make evidence-based practices standard. That's why we collaborate with all the different level 4 NICUs on what we are doing for the NICU babies, not pediatric, because pediatric is more established than the NICU.
Right.
So that's what we're trying to do, like feeding protocols and how do you manage TPN, when do you stop TPN, what do you do with the line, when do you re-anastomose.
There's so many conflicts when it comes to that. How long can we keep the TPN? How long, if we push the enteral feeding but we back off the TPN, are we going to go into a situation where a baby could be dumping? How long does that central line need to be in? Central line associated infection. So there's a lot of factors that are competing, and I think it's very hard. I think I'm going to let Katie share some of her thoughts as well, but then I have some more questions about that.
Yeah, I mean, I think we just, like I said, being a newer focus group, we're kind of starting at the very basics. And so we honestly just started with a survey to see how different it is. And I think we were expecting it to be different, like Pritha was saying, because there's not great randomized control trials saying yes, this is what you should do. But it was honestly also surprising at how different it is. And so I think just even starting to just show and cast a light on the fact that it is really different, and it kind of shows that we don't really know what's best practice. And I think hopefully moving forward, we've even talked about if someday we could help, maybe do some of those studies. So we have numbers, we have, there's a lot of institutions, and maybe we could someday just to see,
And I think some of the things that may to us seem like forbidden as neonatologists are still very much possibilities when it comes to the management of babies with intestinal failure. Like sending home a baby on TPN is something that is a possibility. It maybe doesn't need to be the standard, obviously. But I think that, to me, when I read about it and the more I tried to learn about this, it's something that as a resident, as a fellow, you're like, wait, what? Like, no, like that doesn't, that's not real, right? And I think we need to understand that, don't you think, for our clinicians in order to try to maybe provide a tailored treatment to our babies based on their pathologies?
I think the mindset we were all brought up with, as through our neonatology course, like kids have to go home on full enteral feeds.
That's right.
And
With
I
no
think
NG possibly.
with no NG, with no G-tube, they have to eat. And that's what we tell the moms. When they're eating everything by mouth and growing, that's when you go home.
Right.
And with this population, you're like, oh, no, that's not happening.
Right.
Yeah, I think especially this group of babies have these sometimes really protracted admissions than what was expected for their, let's say, pathology. And, then we really hit that balance of, development's already compromised because nutrition's compromised and they're stuck in the unit with us. So what sorts of outcomes do you guys hope to tackle?
I mean, the dream would be, a lot of things, like you said, but I think we're still trying to figure out, what we can. Because CHNC is wonderful and it's a great resource, the database. But I think just also figuring out what we can do together and like the number of institutions that we're working with to figure out what we can. Because the dream would be to figure out all the outcomes, what we're doing to neurodevelopment, because I think that's still a big question too. But I think that would be further down the line.
I think interim growth as well. And I think with our CHNC group, we have a lot of GI people who are interested, a lot of surgeons who are interested, and it's not just the NICU perspective. They are willing to come to the table from their pediatric part and share with us like what works, what doesn't.
Yeah, I think that's a very
interesting.
interesting, because many of our colleagues who've been on the podcast since yesterday have said something, a recurrent theme, that variability presents opportunity. I've written that down. And I feel like in your case, though, variability seems like a very scary perspective, because we all have different feeding protocols. I think none of us are happy with our feeding protocols. And so you're coming in where, I don't know, maybe I'm wrong, but it sounds like feeding in the NICU is probably where we would see the most variability, where everybody's doing things differently, none of them evidence-based. And so how do you, as members of the CHNC, how do you take this and create a cohesive movement towards QI?
I think the strength of CHNC is it's a lot of, I think 43, 44 like level 4 NICUs. We're
Right.
dealing with the same population that we are dealing with. And from there we pull in like, okay, what works for you may work for us. So when you look at all their feeding protocols and say, okay, this is the consistent thing I've seen in all, then you can say, okay, hey, this is what we are proposing.
I see. That's interesting.
Yeah.
Yeah.
Do you have another side?
Well, and I think it was just interesting that when we did the survey, just to see, because you get so focused on what you do at your institution, even if it's not evidence-based, you just think like, this is my practice, this is what we do, and you kind of just get used to it. And so it was nice to see the differences and see what other people are doing, like, oh, that's possible, like I have never even thought of doing that. So it also sparked some ideas on just expanding like what's out there and what's possible. So that's been helpful and interesting too.
Yeah, and I think you have this opportunity with the database, like you said, looking at this opportunity, right, to do something different for these babies. And you do have hospitals doing different things, right? Like if you could set up that study and have different, arms, you already kind of have that. And so being able to look at them look at the outcomes even by, feeding style, I think that's a really interesting opportunity.
Yeah.
It sounds like it's an exciting time because there are so many unknowns. How can people get involved with the group? We have a lot of trainees who listen who maybe haven't found their area of interest yet, and it sounds like there's still a lot to discover on this topic.
Yeah, so we're always open to new members. If you're part of the CHNC, feel free to reach out to us. Our email address is just intestinalfailure@chnc.org. So
Simple.
really
Very
easy
nice.
and very to the point. And so they can find us that way, or they can reach out to kind of Kelly, can kind of get them hooked up with us. But we're always happy to have new members. And like Pritha said, we have many disciplines, so GI, surgery, we have in neonatology, we have MDs, dietitians, APPs, nurses. It's a great group.
I guess as we're coming close to the end of this discussion, I have one more question about the future of intestinal failure research and how you guys are looking at this from the perspective of the CHNC. I feel like we've been doing a lot of the management of intestinal failure in the same way for many, many years, right? We try to create protocol, we try a feeding regimen with different set of advances and so on and so forth, TPN. But is there something out there that you guys are looking at and you're saying, man, this new tool might be a game changer for us, whether it is genetic testing that are going to allow you maybe to understand your patients better and maybe target a treatment in a much more direct fashion? Is there anything like that you guys are excited about?
I would say the stool. What goes in comes out, right? So why do some kids thrive on full enteral? Why some kids struggle the entire time? I think it's something to do with your microbiome, and that's what Katie will be looking at soon. And Misty Good is looking at it. A lot of researchers are looking at it.
Yeah, so I think it'd be interesting to see, like the microbiome. I think is exciting.
I was not expecting that answer. I was expecting some type of Google computer that was gonna. I was not expecting poop to be the new answer, but it makes a lot of sense. I think if you guys understand how digestion process happens on an individual basis, I think it may uncover a lot of issues. So yeah, that's interesting.
Very interesting. That's a good question.
Any other?
No, it's exciting. We're really looking forward to seeing what your group puts out, because I know it's something that our unit is struggling with, and units all over the country. So I think it's really important work, and we're looking forward to hearing more.
Well, thank you. Thank you for having us.
Thank you, guys.
Thank you. Thanks.